My name is Professor Dr. Shahrul Amry bin Hashim. I am a consultant cardiothoracic surgeon at Damansara Specialist Hospital 2. A bit about myself, I graduated in 1998 in the University of Manchester, and then subsequently I worked in the United Kingdom for about 8 years before returning back to Malaysia in 2006. So throughout those time, I've been inclined to do heart and lung surgery, and then from I think about 2004, I was solely practicing training to be a heart and lung surgeon. And then upon returning to Malaysia, I worked briefly in Institut Jantung Negara, where I had my further training. And then subsequently, I moved to University Malaya Medical Center as a consultant cardiothoracic surgeon before joining Damansara Specialist Hospital. I mean, throughout the latter part of my training, I've been concentrating on honing my skill in minimally invasive heart and lung surgery, which is my main practice at the moment. So our journey in developing Heart and Lung Center at Damansara Specialist Hospital 2 begins in April 2024. So prior to that, there was no heart and lung surgery service in Damansara Specialist Hospital. But when we started in April 2024, we already purchased high-tech equipment with in mind of starting a minimally invasive heart and lung surgery service right at the word go. So in my mind, what stand out compared to other center, when we start off, we already established our center as the center for minimally invasive heart and lung surgery in Malaysia compared to other centers which start as a general heart and lung center before going into a more subspecialized area. So with that, very fast we acquired a lot of experience, and then over the last 15 months, I think we probably have done most of the numbers of minimally invasive heart and lung surgery in private center in Malaysia. And on top of that, over time we have purchased multiple specialized equipment to help with our surgery, and also we have increased the manpower in terms of support staff to support our surgical patient during the pre-operative period, and then during the period after the operation in ICU, and of course during the rehabilitation process. So as a whole, I think when we started up until now, we have really established ourselves as a major leading center in heart and lung surgery, solely concentrating on minimally invasive heart and lung surgery. To be specific about success story of patient who had minimally invasive surgery, probably I can say recently I had a patient all the way from Tawau in Sabah, and he's been searching for this kind of surgery, researching in internet, and even went to visit a center in China before he come across our article in a magazine called The Edge, and he read about the article, and then he flew all the way from Tawau to seek help with us, and then he consulted me, and then after few consultation, I found that he's suitable to undergo his heart surgery via the minimally invasive method, and then he underwent the procedure, and then the procedure turned out to be very successful. He returned back to Tawau like within 1 or 2 weeks after surgery. And why I think it's successful, because he's been searching for this procedure in Malaysia for almost 6 months already before he come across our center.